other side. Go on the other side of the table.
Kyra.
You gotta go on the other side of the table. Yeah, just put your gloves on and move to the side, on the other side of the table. You know what I mean? Like that side.
This one?
Yes. You're setting up on the right side of the table. Yeah.
How am I supposed
It's like. Put your on the other side. Okay.
No.
Don't look at me. I
Go
can't
your
see.
cover. Oh. Don't you keep going? Yeah, keep going.
Okay, indicator strip inside of the instrument tray is good. It is, but it, yes. Filter inside is good.
This is good.
I don't know if it's supposed to speak or not.
the silver strip out, where your right hand is right now. Just pull it out. There should be a little lip there. Pull. Pull.
Oh. Oh.
Open them up. And lay it on. So it's in half. You don't have to take that silver thing off.
I don't.
No, just open them up and lay them on there.
Like that?
No, along. So
Oh.
it hangs out on both sides. Yep. There you go.
Do I need separate?
Put a towel over. Nope.
Okay.
Mhm.
Thank you, Jill.
Okay, you can film me. Let's just leave it there. How many minutes did you get, Jess?
Like 13.
Okay, so 13. So we're going to go over some things that can help you make this better.
Okay.
Now you know that your mock surgery test will be in 15 minutes. So that means in 15 minutes you're going to need to add a guard like you did. You're going to need to gown and glove yourself. You need to drape all your tables. You will need to count your instruments. You will need to have your drape set up, gown and glove your surgeon. You'll need to drape your patient, which will be in an abdominal case squaring off with your 4 towels and your lap drape. And then you'll need to throw off your cords, such as your suction and your cautery, and do a timeout then. Throw up a sponge and then hand the surgeon the knife, and then that would be the end of your 15 minutes. Now, I'm going to critique you, tell you a few things that you could improve on. The first thing that happened is, actually, you have hair hanging out here. so you wanna not have hair hanging out. When you did the waterless scrub, you came into your room and really your mail stand was facing that way. So you should have gowned on the other side, facing where you are now. Instead, you had gowned here. Then another thing that happened is Wintra, as her RN, you went to turn her, and then it was really close to contaminating. I don't think you did because Winter touched the end of the card, and then, right, and so your job will be to take the card off and to go around her. So you did that properly, but you almost grabbed the card back, so it was really close. You could have contaminated. I don't think you did, but you could have. Another thing, Winter, when you were looking for the indicator, you were like leaning over the tray, and you can't do that. So your job as the RN is to look at that indicator on the outside, which might be tape, it might be tamper resistant, the little plastic peg that's in the tray, so then you would have needed to look at that. Your job is to look at the indicator on the inside. Now, do any of you know where a big issue occurred with contamination? Well, Winter, you should have moved that ring stand away. Way too close in here for her setting up. And so when she was draping her mail, the metal of the ring stand was too close to her mail stand. But Jill, you checked for an indicator, you just never checked to see if the instruments were open and not ratcheted. So that meant that when you go to put those instruments on, if you find one that's ratcheted, we don't know what all you've touched, probably everything. So this whole setup has to be torn down now. So you needed to pull out your stringer and make sure your stringer is not ratcheted if they're using something like a sponge ring forceps. And you should have looked at all of these and made sure that they were open. Now another pointer I'm going to give you is you did a lot of redundant things. You kept moving things. And I know you were thinking, trying to reason things out, but this whole draping thing was kind of crazy because you've got, I don't know how many towels you've got on here, you're a little overkill. Not that you did bad on that, and you have never done the suture before, so you didn't know how to pull that out. Now that's a whole pack of the same size suture, so you want those all together. And the reason we put a towel on top is so that suture doesn't get wound around the ring, the ratchets or whatever, and so that's why we protect that suture underneath. But then you buried it. So you would have wanted to be able to see it, so when you go to hand it to the doctor, you can pull it out like this.
That's why.
Now, let's get to counting. Besides redundant things, I tell you the truth, before I would have put up all the instruments, I would have wanted to get all my gowns done, my drapes done, my gloves, so you should have done that. So you should have stacked up 4 towels and your lap drape, and then your gown and gloves for your doctor and PA or who's ever coming. Another thing is when you count, you want to take everything out of here, like take these retractors out. So you started counting as you were taking them out. I think a better way to do it would have been to take all the retractors out, take all your tissue fit forceps out, lay those out, take your knife handles and that out. And then it frees up everything to do your count. Now your RN's going to have the count sheet, and they certainly are not going to be standing this close, but their job is going to be to stand and look at the instruments as you're counting. And it's a good idea to take something like a knife handle, and then either Wintra, the RN, might say perforating towel clips, and you're going to go 1, 2, 3, 4. Non-perfs, 1, 2, 3, 4. Curved Kellys, 1, 2, 3, 4. Cokers, 1, 2, that sort of thing, and you kind of separate them with this. Don't hold your hand over the instruments so they can't see them. Your RN needs to see them. So that's another thing you could have done. And then, of course, you would have needed to take everything out of this splash basin and set that and put it where it's going to live. Another thing you did was you took your tray and you moved it from there over to here and all of that. So I know this is only the second day we've done this, so we need to get better organizational skills. We got to get faster. However, I thought you were really thinking things through. Finish what you start, put things where they live, and watch your aseptic technique. Winter, I know we were trying to film this, so we were like, well, how much should we say or not? Because we wanted you to make mistakes so that we could play this back and look at them. It's easy when we're sitting here as an audience. It's not so easy when you're in the role of doing it. But your RN really, their role, you got to work as a team. They should be helping you too. So she's, well, this you want over here more. You're right. You don't want that like that. And you can't drop your hands when you drape it. But we didn't even get to this yet. But the whole point would be you need to put this where it's going to live. Other thing than you would have needed to do is count your sponges. And remember, when we count, we snap the string and we totally separate everything. If we have more than one pack of laps, it would be 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Not 1, 2, 3, 4, 5, 6, 7, 8. It's 1 through 5, 1 through 5. Your longs, 10s, or Ratex are 1 through 10. You would have put your light handles out, your blade and needle guard box out, your garbage could go on your back table. So you had a lot of things to do yet, and then of course speed up. So we'll just keep working on that. So this will be a good video, I think, for you all to see, to kind of look at and see what the expectations are. So
The ring
questions?
stand, when she opened it, she opened it away from herself first.
Oh, did you?
Yes.
I missed that.
So I should have kicked it and turned it around.
Yep.
Well, you either turn the basin around when you put it in there so the envelope fold is towards you, or put it in and then you have to spin this around. Whoops. Yeah, like that. Not like that. Then you have to spin this around so that you, as a sterile person, you're always opening towards you. As an unsterile person, it's away. So, all right, enough of this video.